Hey, gorgeous. Welcome to Season 2 of the Hormone P.U.Z.Z.L.E Podcast. I'm your host, Coach Kayla Smith, CEO of the Hormone P.U.Z.Z.L Society, a women's health hub for fertility, hormones, and the business of coaching, creator of the Hormone P.U.Z.L method, an infertility warrior, two-time boy mom, and women's health expert. This podcast is for women struggling with infertility, painful periods, terrible PMS, or really just any symptom of hormone imbalance that they are ready to eliminate for good. Tune in weekly as we interview amazing experts in the fields of women's health, breaking down those hormone walls, nerding out on nutrition, and having way too much fun. Whether you're beginning your journey or you've been struggling for years, we're going to finally help you put those pieces of your hormone puzzle back together so that you can get pregnant and eliminate those pesky symptoms for good. Are you ready? This season is packed with even more expert guests sharing groundbreaking knowledge, giving you that jolt of energy that you so desperately need, sending you lots of virtual hugs, and inspiring you to take your fertility into your own hands and make that baby. Thank you so much for tuning in. Now let's get started on your road to transformation. Today's guest is Angela Grassi. She's an internationally recognized author, speaker, researcher, and consultant. She is the founder of the PCOS Nutrition Center, where she provides evidence-based nutrition information and coaching to women with PCOS to help them reclaim their lives from PCOS without diets. Her research and work has been published in numerous peer-reviewed journals. Angela is the author of several books on PCOS, including PCOS, The Dietitian's Guide, the PCOS Workbook, Your Guide to Complete Physical and Emotional Health, and the PCOS Nutrition Center Cookbook, recognized by today's dietitian as one of the top 10 incredible dietitians making a difference. Angela is the past recipient for the Outstanding Nutrition Entrepreneur Award. The award in excellence is practiced in women's health and the award for excellence in graduate research from the Academy of Nutrition and Dietetics. In addition to PCOS, Angela has been treating individuals with eating disorders for over 20 years. Having PCOS herself, Angela has dedicated her life to advocacy, education, and research of the syndrome. For more information, visit her website at www.pcosnutrition.com. This show is all about PCOS, nutrition, supplements, and lifestyle. How to thrive with this condition and not just survive. I cannot wait for you guys to meet Angela, so let's welcome her to the show. Hey, Angela, welcome to the show.
Hi, great to be here.
I'm excited to talk to you today. So let's jump right in. Why don't you tell our audience more about you and how you started working in women's health and around PCOS?
Sure. So I am a registered dietitian nutritionist, and I'm the founder of the PCOS Nutrition Center. So I specialize in helping people with PCOS really reclaim their lives from PCOS. And I've been doing this for 20 years now. And wow. I got into this because I got diagnosed with PCOS. Mm-hmm. And at the time, there really wasn't many resources, and a lot of people didn't know what PCOS was. And at the time, I was actually working at an eating disorder treatment facility. And so I was treating people with eating disorders and started to see actually some patients who had eating disorders that also struggled with PCOS. So, and there's definitely, now that we see a little bit more research, a connection between the two.
Yeah, I was going to say, I bet there is, because, you know, with PCOS, it's so hard to lose weight. And so I'm sure that some people will restrict their calories thinking that's the way to do it. and then an eating disorder starts to form. So
absolutely.
I can definitely see that link. Well, I love it. I find so many of us too start working in, what our stories are. And so that kind of morphs into what we want to focus on in our careers. So I love that.
Right.
Yeah. So talk to me a little more about how do we get a diagnosis? So I know a lot of people have this question, they go to their doctor, they have these symptoms, and some doctors are quick to say you have PCOS, maybe you don't, and some you have all the symptoms and they're, lacking in diagnosing you. So how do we really go about doing that?
Yeah. And it's so frustrating. I saw a survey of, I think like over 1,000 women with PCOS, and it took them at least 3 different doctors before getting an accurate PCOS diagnosis, which is crazy.
That is
so many women go through their whole lives, and then when they go to try and get pregnant, then they find out, oh, you have PCOS, because PCOS is the most common cause of ovulatory infertility. But before, when they had the irregular periods, maybe when they were a teenager, they were just given birth control and say, right, just take this. So it'll fix your periods, but it's just a Band-Aid. Yeah. But an accurate diagnostic criteria for PCOS, it's currently an agreed upon criteria. There's still so much of PCOS we don't know. And it's really a diagnosis of exclusion, but usually somebody has PCOS if they have at least 2 of the following 3 criteria. The first is if they have irregular periods. So what that means is 8 or fewer periods in a year. It's not normal not to get your period.
Right.
So that's a red flag right there. Sometimes there can be other causes why you don't get your period. It could be that you're not eating enough. It could be doing a lot of exercise, low body fat. A lot of athletes don't get their period. But we also look at family history too with that. And, do you have a mom or a family member that also had irregular periods or PCOS perhaps? So the first criteria is if you have irregular periods. And the second criteria is if you actually have what we call the follicles on your ultrasound. So they will do a transvaginal ultrasound is the best way to look at your ovaries. And they're going to look for little follicles. And these are typically mistakenly called cysts. And they're not cysts at all. So cysts are actually large fluid-like sacs that can rupture and be really, really painful, like ER visits.
Right.
But in PCOS, these are teeny tiny follicles that really don't cause harm. You don't even know they're there. They can go away. And it looks like a string of pearls. And this is what they would see on an ultrasound.
Gotcha.
And then the next criteria would be do they have blood tests that show high androgen levels? So androgens are male hormones like testosterone. So they would look at a free and total testosterone. And this is done when you're not on birth control, because if you're on birth control, it can really affect the results of that. And even if your levels are within normal ranges, they still consider the physical signs of having high testosterone. So what that might look like is acne. It could be extra hair growth, especially in the central part of the body, like a lip area, chin, belly button, inner thighs. That's kind of consistent with the PCOS. Hair loss, male pattern balding, alopecia. But again, PCOS is really a state of exclusion. So not everybody with PCOS might have these follicles on their ovaries, right? Some people with PCOS will get regular periods every month. So it's really important to rule out everything else too.
Gotcha. And why do you think it's so hard to get a diagnosis? Just because it shows up different in everybody, and so it's hard to kind of pin down if this is what it is?
I think PCOS is such a spectrum that there's so many different degrees of severity, and depending on where a woman is in her stage of life, like early on in teenage years, maybe somebody doesn't have the follicles yet on an ultrasound. And what teenager doesn't have acne?
Right.
Or they're quit. Yeah. So it's really hard to, you have to know PCOS. You have to be really familiar with it. And the blood test, even testosterone, isn't like a totally accurate test. There's a lot of variability to it. So
Gotcha.
It can be tricky. Yeah.
So, and that's why I always on this show, and I'm sure you feel the same, I am a big proponent of advocate for yourself. If you have symptoms and your doctor's saying that you're normal, or, you don't have PCOS, but you're like, I'm pretty sure I do based on these symptoms I'm having, then, find a new doctor. Make sure that doctor knows they need to really accurately test you to find out if this is what's going on.
Absolutely. That's how I got diagnosed. I did see like 2 different doctors before, and they just didn't know enough about it or didn't know the right tests. And I just constantly knew something wasn't right.
Yeah. Gotcha.
Yeah.
And so how do you think, how easy is it to holistically heal and kind of treat your PCOS?
I think it's really realistic. I mean, certainly we have more conventional methods. Some people that are very insulin resistant or have some other metabolic aspects related to PCOS might benefit more from those. But regardless, holistic treatments are going to improve PCOS. And it really comes down to your physical and your emotional health.
Mm-hmm. Yeah. And I see this all the time with my clients. They come in and they're having all these symptoms and they're, really struggling with infertility. And I've been able to get many of them pregnant, even with PCOS, just by, holistic living, diet, and lifestyle.
Absolutely. Absolutely.
Yes. So let's talk a little bit about supplements for PCOS. I get this question a lot, and I'm sure you're the same, being a dietitian nutritionist. Food first, which we'll definitely talk about food in the second half. But, if we're doing the food and we're eating super clean, but we still have some holes, what are some supplements that we might want to add in? Or first, before we get into specific supplements, how beneficial are these supplements?
Yeah, I think you bring up a really good point, because no pill is going to replace what we can get from food, right? There's so many aspects of food that we can't get from a pill, like the synergy and the fiber and the nutrients working together. But there are some situations in PCOS where we do see supplements can be helpful. And there are some studies that look at vitamin levels in people with PCOS, and they do see that women with PCOS do have some deficiencies across the board. For example, vitamin D tends to run really low, and it tends to run low for most people.
Right.
But especially with PCOS, we do see a link with it helping with hormones and playing a role in androgens. So that is definitely one that I sometimes look at with my patients, is getting a vitamin D level in their blood and seeing what their levels are, especially if they are trying to get pregnant, because vitamin D is so important. It's a vitamin, but it's also a hormone. And there's vitamin D receptors on every cell in our body. And especially at our eggs, our egg quality. So that is definitely one that if you are trying to get pregnant, I would suggest talking to your doctor, your dietitian, or your health coach about, because that can really make a difference for your fertility.
And that's
to optimize your pregnancy. Yeah,
for sure. And that's one too, you really have to ask your doctor, your healthcare provider, because unless it's a holistic, like health coach, nutritionist, most doctors aren't just doing vitamin D testing. You have to ask for it. So
you have to be your own advocate. It's really unfortunate, but you do. Yeah. I know I hear sometimes people are like, oh, my doctor told me it was too expensive to do the vitamin D test. Or we did it a year ago, so why do it again?
Right.
At least every year, I think it's good to see. And the other thing with vitamin D is it is fat soluble, so you want to take it with fat. So a lot of times I'll ask my patients that if their level's still kind of low, I'm like, when are you taking your vitamin D? And I look at what they're eating with it, if they're eating, and that's really important because it absorbs better with fat.
Yes. So take it with your breakfast and have some fat with that breakfast for sure.
Yes, absolutely. Yeah. So vitamin D is a key one. Sometimes if someone's taking like a medication, birth control pills or metformin, heartburn medications, they can actually affect the absorption of vitamin B12. And that is a vitamin that can cause permanent nerve damage. It can affect mood. It can cause a whole bunch of problems. Tingling in the hands and feet is like a sign of it. Fatigue. So this is something, if anybody's taking any of those, they should really have their vitamin B12 levels checked. with a blood test and consider supplementing with that, because that can really make a difference in their energy and mental health too. But sometimes, we see that some supplements can help to be a little bit more aggressive dealing with the insulin resistance part of PCOS, which at least 70% of women have been found to be insulin resistant with PCOS. And having high insulin can lead to weight gain. It can lead to those strong carb cravings that a lot of people with PCOS experience. I know you're nodding your head. You totally see it probably a lot with your clients. Really strong, urgent cravings for carbs and sweets. So in those instances, there are some supplements that can be helpful. One of my favorites is inositol. Mostly myo-inositol. D-chiro-inositol has also been studied in PCOS, but what these are relatives of the B vitamins, and they're finding in PCOS that there's a problem with the enzyme that converts myo-inositol into D-chiro-inositol, and in PCOS that's happening too fast. So that means myo is getting converted into D-chiro really quickly, and it's depleting levels of myo. And myo-inositol is really important for egg quality and ovulation. So this is a good one if you are trying to get pregnant. In fact, a lot of my patients who don't get their periods, when they start taking this, the majority get their periods back in a matter of a few months. And here they are, always told to take the pill. So this is great, especially for teenagers, that you don't want to just jump to birth control right away, is to look into inositol. And inositol also helps with insulin sensitivity. So it can help lower A1C and curb those carb cravings too. So this is a popular one, really, that can be taken at any stage of the life cycle with people with PCOS.
I love that one. I have a lot of great success with it. My clients are just like, oh my gosh, I feel so much better. My cravings are gone. Like my weight loss is jump started. And so it's a really good one. Yeah.
Yeah. It works with insulin signaling. So it's really helpful. It can be really helpful. Yeah. Another one is N-acetylcysteine. This is known as NAC. NAC is a powerful antioxidant, which can also help improve insulin. And this one has been shown to help with egg quality and fertility too, for improving it. So a lot of times if you're struggling with infertility, that could be a good one to try. And then a little bit more aggressive would be berberine. So this is an herbal supplement. It's been around for thousands of years, always been used as a treatment for type 2 diabetes. And its properties have actually been compared to that of metformin because it's that powerful at reducing glucose and insulin and even cholesterol too. And fatty liver, berberine can be really helpful.
That's another one I really like. Yeah.
Yeah.
Be careful though, because it is strong. So, audience, don't ever take a supplement until you talk to your healthcare professional or provider. But yeah, that one's another one of my favorite ones.
Absolutely. And I always recommend starting at the lowest dose and staying at the lowest dose for even a couple weeks just to adjust to it and see how you're doing. You might just need the lower dose.
Yep, exactly.
Sometimes less is more. Yeah.
Yes. And so how do we know if these supplements are working? Will we start to feel different or, maybe symptom reduction or even symptoms going away?
Absolutely. So things to look for to see if something's working is how you feel, right? That's the first thing. And you might want to keep a journal and just kind of like once a month make notes. It takes a while to make changes. So maybe a month is a good time to look and monitor your symptoms. So sometimes taking pictures, like if you have hair loss, take a picture of that hair loss part and then compare it. Or if you're having acne, compare your face. Maybe you're taking zinc, and zinc's been found to inhibit testosterone. So maybe, that can be helpful. And that's, something to look at. Is this dose enough? Is this good? And then looking at blood tests too. So I like to have my patients get blood work taken every 3 months. So we can do like a before and after to know if something is working or not, or if we have to tweak it.
For sure. I completely agree with that. Yeah. And definitely keep a journal, write down your symptoms. Yes. That is so helpful to kind of see, like, is it working? Because sometimes I feel like when you're in the thick of it and you're not paying attention to symptoms, coming and going, you might think this is normal. But when you really start to look, you're like, oh yeah, my acne is clearing up, or, oh yeah, I feel like I'm losing weight faster than I was before, or whatever it is. So you just really have to kind of journal that.
Yeah. And the other thing to think about is, things aren't going to work right away. You have to be consistent, like just dabbling and maybe taking a multivitamin here and there, or maybe taking vitamin D. That's not going to get you good results. You really need to be consistent. It's usually going to take at least a month to see some differences. So being patient with that. A lot of people are like, oh, it didn't work, and they only gave it like a couple weeks.
Right.
Okay.
I know. I had that happen today. One of my clients was like, I went and had my blood done, and it's still like, some of my levels are still pretty high. And I'm like, well, it's been 2.5 weeks, so we need to keep working. It's not an overnight fix. Holistic health is not a quick fix. It's a lifestyle, and you have to work at it and give it some time to see those results. So, yeah.
Absolutely. Absolutely. You have to be patient. Yeah.
Yes. And so what do we do if our doctor is, they kind of push back on these supplements, and they're like, well, I've never heard of that. And they really aren't giving you, the support you need around supplements.
Yeah, it's really frustrating because really doctors maybe get one nutrition class in their whole medical school.
Yeah.
So they might not know about these, or they might think, that supplements aren't like anything like medications, and that they're not effective. And that's, highly from the case. They really are, in certain situations, effective. So I think sometimes I've had patients even bring in research studies. And if the doctor's still against it, I mean, it is your body. You can go to a different doctor. Maybe one that will focus on holistic healthcare and be integrative and consider these approaches. And sometimes you have to educate them, not just bringing in the studies, but saying, I'm going to take this and check my blood levels. Let's see the difference, for them to believe it. Yeah.
For sure. Yeah. And I find too, like you said, I love what you said about, it is your body. And if your doctor's pushing back, even with the research, even with the, I'm going to try this anyways, then maybe it is time to look for a new doctor and find one that's more into holistic health.
Yep. You have to trust your doctor. You really do.
And so let's talk about some myths. Do you ever hear of any myths around PCOS?
Oh, never hear myths.
Right? What are maybe one or two that we can debunk?
Okay. Well, I think a big one is that people with PCOS shouldn't eat gluten. I hear that a lot. There's no evidence at all to suggest that. So what I recommend is, some people do feel better without gluten, but some don't. And you got to remember that PCOS is a spectrum. Usually, if someone's going to feel better eating gluten-free, maybe they have some digestive issues that would warrant that. Maybe they have a sensitivity, maybe they have IBS, irritable bowel syndrome. But sometimes, we have to look at what are the factors that are making you feel better. Because for IBS, for example, it could be fructans, the hard to digest food, which could be gluten for them. And when they cut it out, they feel so much better. But then you hear people just saying, oh, I cut out gluten, so, that's the way people with PCOS should eat. And you have to remember that it's got to be individualized. Yeah. So that's a common one. Another one is that people with PCOS shouldn't eat fruit.
Yeah.
Because fruit has sugar in it. And so they hear that that is bad for people with PCOS. And it's actually, fruits and vegetables are antioxidants, and they can help reduce insulin. And that can really help improve PCOS, is eating fruits and vegetables. In fact, they have many studies that looked at whether it's a DASH diet. This is a diet designed for people with high blood pressure. It stands for Dietary Approaches to Treat Hypertension. And it's really rich in fruits and vegetables. And they use that diet in people with PCOS in some studies with really good results. So Fruit has fiber and lots of vitamins and minerals to help PCOS. So the key is balance.
Yes, I love it. Well, we're going to take a short break to hear a word from our sponsors, and we're going to come back in and dive into more practical tips. Okay, what food should we be eating? What should our lifestyle look like? So we're going to do all of that when we come back. Hey y'all, it's Coach Kayla here. I hope you are loving this episode as much as I am. We will be back in just a minute, but first, a word from our sponsors. This episode is brought to you by the Hormone P.U.Z.Z.L.E Society, a women's health hub for fertility, hormones, and the business of coaching. Whether you're struggling to get pregnant with pesky hormone symptoms, or you're working to build a career in the fertility and women's health space, we have you covered. Visit our website at www.coachkayla.com to learn more on how we can help you. Text the keyword fertility to 615-257-8855 for your free fertility meal plan. Hey, Angela, welcome back.
Hi.
All right, let's dive into some practical tips. Let's talk about food. What should we be eating with PCOS, and then what should we be kind of steering clear of?
Yeah, my favorite topic. So at the PCOS Nutrition Center, I actually recommend focusing more on foods to include rather than take away. So foods that are really going to help improve your PCOS. And a lot of it is getting the education and understanding of how food affects PCOS and hormones and insulin. But what we know is that higher fiber foods tend to not spike up your glucose and insulin, and they tend to leave you feeling more satisfied. And higher fiber foods tend to have more nutrients in them that will help bring down insulin and balance hormones. So I tend to help people to understand what foods are high in fiber. So we think of whole grains, we think of grains like quinoa, whole oats, things like that. And we think of fruits and vegetables, and we think of other high fiber foods like beans and lentils. So these are all great for keeping blood sugar levels stable. And then adding in with the fiber-rich foods, some protein and fat. So that is what we consider a balanced meal, is having some fiber, protein, and fat to help feel satisfied and to get all the nutrients in. Protein, really great for balancing out the carbs and for your muscles and for really so many aspects of your body. And then the fat, especially the omega-3 fats, are anti-inflammatory. And we know that PCOS is a state of low-grade inflammation. Just having that higher insulin raises your inflammatory markers. So foods that have fruits and vegetables and those omega-3 fats can actually help to reduce inflammation. So omega-3s would be something like fish or avocado oil, olive oil, olives, and things like that. Yeah.
I love that. And should we really worry about soluble versus insoluble fiber, or, because so many foods have both, we really don't have to think about that?
Right. I think the key is just to eat a variety. They both do different things, and they're both really helpful, soluble and insoluble, and some foods have both. So I think by eating just a good variety of fiber-rich foods, you'll be able to get both in. And it's kind of looking at your bowel movements, like how often you go to the bathroom. It should be once a day, and it shouldn't be hard or anything like that. And that's a way to know how your body's functioning.
Yeah, at least once a day. I was working with a nutritionist recently that was saying up to 3 times a day is normal. So,
well, sometimes that can be a sign of an intolerance or like a food allergy or something like that. So you got to be careful. If it's like a diarrhea, that's not good either.
No. But at least once a day. And nice bowel movement. And I can't remember the name of it, but there is a chart that shows you kind of like, this is what a healthy poo looks like.
Yes.
I can't remember what it's called, but that is so helpful to kind of say, am I constipated? Do I have diarrhea? Is this normal?
Exactly. Yeah.
Awesome. So let's talk about any foods that, I know you said you try to focus on what we can have versus what we can't, which is exactly what I do here. But is there any foods that you're like, okay, that definitely we should stay away from?
Not unless you're really having a reaction to it or an allergy or a sensitivity. I mean, really, I don't like to put any rules or stay away from anything because I think it creates this black or white thinking with food. I mean, if obviously we know that having like sugary foods or foods that don't have much fiber, they're going to tend to spike up your glucose and insulin. So that means you should never have a piece of your birthday cake or your kid's birthday cake or enjoy dessert. Absolutely not. I think, there's plenty of room for those foods. It just comes down to balancing it and really listening to your body. I mean, something I really work on with my PCOS nutrition clients is helping them to eat intuitively. Mm-hmm. And that's really listening to what their body needs. Are you getting satisfied with your meal? Is this enough? Are you going to stop or are you going to keep eating? And if you're still eating past the point of fullness, what's this about? Is this emotional? Are you coping in some way with food? Are you, avoiding something, or is it just it tastes really good and you want a little bit more of it because you never have it, like it's a once a year treat, So really looking at that is really important, and it tells a lot. Your relationship with food is so key.
Mm-hmm. I love that. And that's something I also teach is just intuitively listen to your body and eat till you're full and satisfied, but don't overeat and be stuffed and miserable. And then if it's something you love, then have a little bit, like you said, a birthday cake or, your grandma's famous cookies. I always say have a piece, don't have the whole cake or the whole bag of cookies or whatever it is. So definitely it's more about what you get to have, not what you don't. So I love that. So let's talk about stress. How does stress affect people with PCOS and what do we do about it?
Yeah, so it's interesting because stress can really cause increases in our stress hormone, cortisol, and cortisol will increase insulin, and that can actually make testosterone worse. So it's a whole vicious cycle, and stress is never going to go away. It's part of our lives, our daily lives. So it's really about how do we manage it and managing it on a day-to-day basis. And what's interesting is they've looked at cortisol levels in people with PCOS, and they found that normal in people without PCOS, cortisol goes down at night. But in PCOS, it goes up.
Oh my gosh.
Yeah, so they actually see a lot of sleep problems in people with PCOS. Whether it's sleep apnea or difficulty falling asleep. And that can actually worsen fertility, and that can cause more metabolic issues too and increase the risk for type 2 diabetes. So stress is really something that's important. And I co-authored a book called the PCOS Workbook, Your Guide to Complete Physical and Emotional Health. And in there, we have a whole chapter on stress. And we educate people about what stress does in the body and how to reduce it a little bit. And that's what you have to find your outlets of what's going to help you de-stress a little bit, whether it's listening to an app, a mindfulness app, taking a walk, hitting a pillow, reading a book, whatever you need to de-stress, but it really needs to happen every day.
Mm-hmm. Mm-hmm. I love that. And how does self-care fit into that?
Yeah, so self-care is the key part, because if you're not practicing good self-care, you're going to get more stressed out. You're going to get burnt out. You're giving to everybody else, but you're not giving to yourself. I see it all the time with my clients with PCOS. So you need to fill up your own cup. You have to do things that are going to energize you and make you feel, important, and give yourself love.
I love that. And I completely agree. Well, tell everybody where they can find you. How can they work with you? And if you have any freebie you want to leave us with.
Yeah, so you can reach me at the PCOS Nutrition Center, and the website is PCOSnutrition.com. And there's a whole blog and information and resources there. And you can download my free guide, Ditch the Diets, and learn 5 strategies that do work for PCOS.
I love that. And how about social media? Are you on there?
Yeah, my handle is very easy. It's at PCOS Nutrition.
I love it. And we'll have all that in the show notes. So it'll be really easy for our audience to find you. So I love that. Well, any final thoughts, any words of encouragement, anything you want to leave us with?
I think kind of what we started at is that trust your body and pay attention to your body. It's smarter than you think, right? If we listen to it, it tells us so much. So really listen to it, see what's working and what's not, and be your own advocate. Don't be afraid to get help or try something else if something's not working. But you can totally reclaim your life from PCOS.
Yes, for sure. I love it. Well, Angela, it was so fun having you here. Thank you. Thank you. Thank you.
Thank you. This was fun.
Yeah. And thank you, ladies, for listening to the Hormone Puzzle podcast. Until next time. Bye. Hey, hang on just 1 second before you go. I want to make sure that you are aware of all of the amazing free resources that I have for you on my website at CoachKayla.com. From a fertility meal plan, a cycle syncing quick start guide, a holistic healing cookbook, as well as master classes, blog posts by me and some amazing experts in the fields of fertility, hormones, and nutrition. So many wonderful resources that will help you on your journey. And I wish there had been something like this when I was going through my 2 years of infertility, but there just wasn't. And so that's why I decided to create all of this for you. So make sure that you go and check it out and you take advantage of this plethora of support that I have provided for you. And spoiler alert, these were some of the same tricks and the same foods that I used to get myself pregnant, not once, but twice, even after my doctors said that I couldn't. So I know that these things work. Make sure you take advantage of that. And I cannot wait for you to be my next success story. So thanks, love. See you soon. Thanks for tuning in today to the Hormone Puzzle podcast. Check out the show notes for today's episode at CoachKayla.com. If you like what you hear, please subscribe and leave a review. Thanks for hanging out with me, and I'll see you next week.